One of the concerns about health care and how you pay for it, 1/3 of the funding comes from cuts to Medicare.
Right.
A lot of times, as you know, what happens in Congress is somebody will do something bold, and then Congress, close to election season, will undo it.
Right.
You saw that with the doc fix.
Right.
Are you willing to pledge that whatever cuts in Medicare are being made to fund health insurance, 1/3 of it, that you will veto anything that tries to undo that?
Yes. I actually have said that it is important for us to make sure this thing is deficit neutral without tricks. I said I wouldn't sign a bill that didn't meet that criteria. And what I also said in that speech to the joint session was that I'm willing to put in some safeguards where if we don't obtain the savings that have been promised, then we've got to make adjustments in terms of the benefits. Because the goal here is to reduce costs for families, give them more security, but do so in a way that is not adding to our deficit, that in fact over the long term, if we can bend the cost curve, will reduce our deficit. And I promise you, we're already starting to look at the fiscal year 2011 budget and the out years, and although we are in the midst of recession and we inherited a big structural deficit, nobody's more mindful than me of the fact that we can't have a bill that simply blows up an additional entitlement that's not paid for.
So Congress needs to know that you'll veto any attempt to walk back what they pass.
Congress needs to know that when I say this has to be deficit neutral, I mean it.